Ensure privacy. Introduce yourself and explain that you're going to be evaluating the patient's neurologic system, which includes cognitive function, balance and coordination, cranial nerves, motor function, sensory function, and reflexes. Access your patient's record. Perform hand hygiene. The neurologic exam starts the minute you walk into the room and greet your patient. Begin by evaluating the patient's level of consciousness. He should be alert and responding appropriate for his age. Note his affect or mood. Is he happy, anxious, depressed, angry, frightened, or hostile? Next, test immediate, recent, and remote memory. To test remote memory, ask the patient about an event that took place a couple of years ago. To test immediate and recent memory, ask your patient.
Is what we call your integumentary system. And that includes your skin.
Perform hand hygiene. Access your patient's record.
So, wash my hands and you'll get us into the computer so I can make some notes about you. Do you have any problems or concerns?
Perform hand hygiene again. When inspecting your patient's integument, which includes the skin, hair, and nails, have clean gloves available in case you encounter any open skin or body fluids. Have a measuring device available as well to determine the size of any incisions, wounds, or lesions. Starting with the patient's head and scalp, inspect the skin for color, hair distribution, and any lesions.
Is any crusting that might make me think of dandruff? Or sometimes if someone has a fungal infection, you can have hair loss.
Be sure to inspect for any infestations, as indicated by the presence of lice or nits.
Scalp. And your scalp looks great. You don't have any birthmarks on your head, do you, that you know of?
No.
Okay. I'm going to look right at the base of your hair. And what I'm looking for there is something called nits. Do you know what nits are?
Systematically inspect all of the patient's skin. Check the skin's color and inspect it for dryness, rashes, birthmarks, bruises, and other lesions. As you inspect, palpate the skin with your fingertips, noting the skin's texture and moisture. Because adolescents usually have an increase in sebaceous gland activity, inspect the face, chest, shoulders, and back for acne. Bruising is common on the knees, shins, and lower arms. Question any bruising on other parts of the body, especially in various stages of healing, as this can sometimes indicate abuse.
And for if it's cold or clammy or really moist. Okay. Another thing I'm going to do is I'm going to check for skin turgor.
Over the patient's clavicle, gently pinch a small fold of skin to check skin turgor.
Over your clavicle, and it just bounces right back to normal like it should. I'm going to look at the skin on your chest. Again, move your arms just a little bit. I'm not seeing any rashes or anything. You haven't been out in the sun yet and got any sunburn. No significant bruising, so that's good.
Privacy can be a difficult issue. It may be necessary to conduct portions of the examination with the child's clothing on. As you inspect the lower extremities, note hair distribution and assess any wounds or lesions, noting the size, shape,